Right now, somewhere in your body, there may be a quiet warning trying to reach you. It can be as small as a sentence that comes out wrong, or a face that does not quite smile evenly in the mirror, or an arm that feels strangely heavy for no reason at all. Most people brush these moments off. They sit down, they wait, they tell themselves it will pass. And here is the part I need you to hear before anything else. With a stroke, the minutes you spend waiting are the most expensive minutes of your entire life. Research from the American Stroke Association shows that during a stroke, on average, nearly 2 million brain cells can be lost every single minute that goes by without treatment. 2 million every minute. That is why the warning signs I'm going to walk you through today are not just useful to know. They are the difference between recovery and lasting damage, and sometimes between life and death. I am Dr. Daniel Mercer. For more than 18 years, I have practiced internal medicine, and I have sat at the bedside of people in the hours after a stroke, holding the hand of a husband or a daughter who keeps saying the same thing over and over. We thought it was nothing. We waited to see if it would go away. I am making this video so that you never have to say those words. Because the truth is, your body almost always gives you signs. The problem is that most people do not know what they are looking at until it is too late. If you find clear, honest health information like this helpful, take just 1 second to like this video and subscribe to the channel. It is a small thing for you, but it helps me reach more people over 60 who deserve to understand the warnings their own body is giving them. Thank you. Now let us get into it, because this is information that could one day save your life or the life of someone sitting right next to you. First, let me explain in very simple terms what a stroke actually is, because once you understand it, every warning sign will make sense. Your brain is the control center for your entire body. Every thought, every movement, every word you speak, every step you take, all of it is directed by your brain. And your brain, like every other part of you, needs a constant, steady supply of fresh blood. That blood carries oxygen and fuel. Your brain is so hungry for that blood that it cannot survive even a few minutes without it. A stroke happens when that blood supply to part of the brain is suddenly cut off. There are two main ways this happens. The most common way is that a clot, a small plug of thickened blood, gets stuck in one of the vessels feeding the brain and blocks the flow. The other way is that a blood vessel in the brain bursts and bleeds. Either way, the result is the same. A section of the brain is suddenly starving, and the brain cells in that area begin to die. Here is the analogy I give my patients. Picture your brain as a house full of lights, and the blood vessels as the wiring that carries power to every room. A stroke is like a wire being cut. The room at the end of that wire goes dark, and depending on which wire is cut, a different room goes dark. That is why one person's stroke shows up as a drooping face, and another person shows up as slurred speech, or a weak arm, or sudden blindness in one eye. The signs depend entirely on which part of the brain has lost its power. Once you understand that, the 8 warning signs I am about to show you stop being a random list and start being a map. Let me tell you about a patient. I will call him Frank. Frank was 71, a retired carpenter, the kind of man who never wanted to make a fuss. One afternoon, while he was reaching for a coffee cup, his hand simply would not close around it. The cup slipped and shattered on the floor. His wife asked if he was all right, and when he answered, his words came out thick and slurred, as though he had been half asleep. It lasted only a couple of minutes. Then his hand worked again, and his speech cleared up, and Frank insisted he was fine. He did not call anyone. He sat down and finished his afternoon. 3 days later, he had a major stroke that took much of the strength on his right side, strength he spent the next year fighting to get back. That brief episode in the kitchen, the one he waved away, was his body sounding the alarm. If he had treated those 2 minutes as the emergency they were, his story could have been very different. By the end of this video, you will understand exactly why, and you will know what Frank did not. So let us walk through the 8 signs your body can give you before and during a stroke. I want you to listen closely to everyone. The first sign is a drooping or numb face, usually on one side. This is one of the most recognizable warnings of all. One side of the face begins to sag. The corner of the mouth may pull down. An eyelid may droop. The cheek may feel oddly numb, as if you have just left the dentist. The simplest test in the world is this. Ask the person to smile. If you watch their face and one side lifts while the other stays still, so the smile looks crooked or uneven, that is a serious warning sign. Do not wait to see if it improves. The second sign is sudden weakness in an arm or in a leg. most often on one side of the body. This is what happened to Frank with his coffee cup. An arm suddenly feels heavy, clumsy, or will not lift the way it should. A leg may buckle, or drag, or feel like it does not belong to you. The classic test is to ask the person to raise both arms straight out in front of them and hold them there. If one arm slowly drifts downward, or cannot come up at all, that side of the brain is in trouble. Sudden one-sided weakness like this is one of the most common signs of a stroke there is. The third sign is trouble speaking, or trouble understanding speech. The words come out slurred, or jumbled, or simply will not come at all. Sometimes the person knows exactly what they want to say, but cannot get the sentence to form. Other times they can speak, but they cannot understand what you are saying to them, as though you were suddenly talking in a foreign language. A simple test is to ask the person to repeat a short, plain sentence, something like, "The sky is blue today." If they cannot say it clearly, or they look confused by the request, take it seriously. Those first three signs, the face, the arms, and the speech, make up a tool that doctors and paramedics use every single day. The American Stroke Association teaches it with the word FAST. F for face drooping, A for arm weakness, S for speech difficulty, and T, the most important letter of all, for time. Time to call for emergency help immediately. I want you to burn that word into your memory. FAST. Because if you see even one of those three signs, you do not wait. You do not call your son to ask his opinion. You do not lie down hoping it passes. You call your local emergency number right away, the same way you would for a heart attack or a fire. Every minute truly counts. Now those three are the most famous signs, but they are not the only ones. And this is where so many strokes get missed, because the brain has many rooms, and not every stroke touches the face or the arms. So let me give you 5 more signs that are just as important and far too often ignored. The fourth sign is sudden numbness, or a strange tingling, especially when it appears on only one side of the body. This is different from the pins and needles you get when your foot falls asleep and then fades in a minute. This comes on suddenly, often covers a whole region like one side of the face, one arm, or one leg, and it does not have an obvious cause. Sudden numbness down one side of the body is a classic signal that the brain is not getting blood where it needs to. And notice the pattern that keeps repeating in these signs. One side, the face on one side, the arm on one side, the numbness on one side. That is because each half of your brain controls the opposite half of your body. So when one side of the body suddenly fails, it is pointing straight back to one side of the brain that has lost its blood. That one-sided pattern is one of the clearest fingerprints of a stroke, and it is worth remembering. The fifth sign is a sudden change in your vision. You may lose sight in one eye, as though a curtain has been pulled across it. You may suddenly see double. Your vision may blur or darken in one half of your field of view. The key word, again, is sudden. Vision that slowly gets a little fuzzier over months is usually about your glasses. Vision that changes in an instant with no warning can be your brain telling you that the part responsible for sight has lost its blood supply. The sixth sign is a sudden loss of balance, dizziness, or trouble walking. The person may stagger as though they have had too much to drink, even stone sober. They may feel the room spinning, or feel that they simply cannot coordinate their legs. They may lean to one side without meaning to. Now, dizziness on its own has many harmless causes: standing up too quickly, an inner ear problem, certain medications. But when sudden dizziness or clumsiness shows up alongside any of the other signs we are discussing, or completely out of nowhere, it deserves to be taken seriously. The seventh sign is a sudden, severe headache, the kind people often describe as the worst headache of their life, with no known cause. This one matters most with the type of stroke where a vessel in the brain bursts and bleeds. The headache comes on like a thunderclap, intense and immediate, sometimes with nausea, vomiting, or a brief loss of consciousness. If you, or someone near you, is suddenly hit with the most violent headache they have ever felt, completely unlike their usual headaches, that is not a wait-and-see moment. That is an emergency. And the eighth sign is the one I most want you to remember, because it is the one Frank ignored, and it is the one that gives you the greatest chance to prevent disaster. It is called a transient ischemic attack, or a TIA. Many people call it a mini-stroke. A TIA produces the very same symptoms as a full stroke: a drooping face, a weak arm, slurred speech, numbness, vision loss, but then the symptoms fade away on their own, often within a few minutes. sometimes within an hour. And because the symptoms disappear, people feel relieved and assume the danger has passed. This is one of the most dangerous mistakes a person can make. A mini stroke is not a false alarm. It is a true alarm. It is your body warning you that a much bigger stroke may be coming. The American Stroke Association is very clear about this, and so am I. Even if the symptoms vanish completely, you still need emergency medical care right away, because for many people a major stroke follows within days. So let me be absolutely direct with you about what to do, because knowing the signs means nothing if you freeze when the moment comes. If you see any one of these signs, in yourself or in anyone around you, even just one, and even if it seems to be fading, you call your local emergency number immediately. In the United States, that is 911. Do not drive yourself to the hospital. Do not wait to feel worse to be sure. Do not take an aspirin and lie down to see what happens, because if the stroke is the bleeding kind, an aspirin can make it worse, and only the hospital can tell which kind you are having. Call emergency services and let trained people come to you. The ambulance is not just a ride. It is the beginning of treatment, and the crew can alert the hospital to be ready before you even arrive, so that the right team is waiting at the door the moment you get there. That early head start can make all the difference in how much of the brain is saved. There is one more thing I want you to do, and it is so simple but so powerful. Note the time. The moment you first notice a symptom, look at the clock and remember it. The emergency team will ask, "When did this start?" That single piece of information helps them decide which treatments are safe to give, because some of the most powerful clot-dissolving treatments only work within a narrow window of a few hours from when the symptoms began. So if you remember nothing else, remember this. Call right away and know the time it started. Now, a word for those of you who are wondering whether you are at higher risk, because some of us need to be especially watchful. The risk of stroke rises as we get older, and it climbs further if you have high blood pressure, which is the single biggest risk factor of all. Diabetes raises it. A history of heart trouble, especially an irregular heartbeat called atrial fibrillation, raises it. Smoking raises it. So does high cholesterol. If any of these describe you, I am not telling you this to frighten you. I am telling you so you take these warning signs even more seriously, and so you keep working closely with your own doctor to keep those numbers in a healthy range. Please never change or stop any medication on your own. That is a conversation to have with your doctor, who knows your full history. Let me give you a simple habit that can make all of this second nature. Once in a while, when you are brushing your teeth in the morning, take 3 seconds to look at your own face in the mirror and smile. Notice that both sides lift evenly. Lift both arms for a moment. Say a short sentence out loud. You are not doing this because you expect a stroke. You are doing it so that your eyes and your mind already know what normal looks like for you. That way, if something is ever truly off, you will notice it in an instant instead of talking yourself out of it. And here is a small bonus that stacks right on top of that. Teach the word FAST to the people you love. Sit down with your spouse, your children, your friends, and walk them through it, just the way I have walked you through it today. Because here is the hard truth about a stroke. The person having it is often the one least able to recognize it or call for help. They may be confused. They may not be able to speak. So the life you save with this knowledge may not be your own. It may be the life of the person who hears it from you. Knowledge shared is protection multiplied. Let me bring it all together for you now. A stroke happens when blood flow to part of the brain is suddenly cut off and brain cells begin to die within minutes. Your body usually gives you signs. A drooping or numb face. Sudden weakness in an arm or a leg, usually on one side. Trouble speaking or understanding. Sudden numbness on one side. A sudden change in vision. A sudden loss of balance or trouble walking. A sudden severe worst ever headache. And the great warning of them all, the mini stroke, where the symptoms come and then go, but the danger remains. Remember the word FAST, face, arm, speech, time. And remember that even when the signs fade, the emergency does not. You call for help immediately, you note the time it started, and you let the professionals take it from there. I know this was a serious subject, and I am grateful you stayed with me through all of it, because this is exactly the kind of knowledge that quietly saves lives long after the video ends. If it was helpful to you, please subscribe and join us here, where I help people over 60 understand the signs their own bodies are giving them, so they can stay strong, alert, and independent for many years to come. Take good care of yourself, watch out for the people you love, and I will see you in the next one. And one last important note. This video is for general educational purposes only, and it is not medical advice, and it is not a substitute for emergency care. If you ever suspect a stroke, do not rely on a video. Call your local emergency number right away. And for your ongoing health, always speak with your own qualified healthcare provider before making any changes to your diet, your exercise, or your medications. Your doctor knows your body best.